Well, thank you for joining me. I'm excited to describe our presentation. We developed a polymeric acidocyst MRI contrast agent that measures. First, just like to acknowledge some conflicts of interest. So we wanted to create a polymeric CEST MRI contrast agent that can measure pH at low concentration because typically CEST MRI concentrations have to be used at very high concentration. Well, one way to do this is to create a polymeric agent. We successfully created a salicylic acid-based polymer agent that can be synthesized with an average of 25 monomeric units. We then demonstrated that this polymer agent can generate a CEST effect at two chemical shifts, 9.2 and 5 ppm. And the monomer also has those CEST at those frequencies as well. Then we were able to show that both the monomer and polymeric agents can be used to measure pH. The CEST effects are pH dependent, and that can be seen in this graph of percent CEST relative to pH, where there is different dependencies for the CEST peaks at 5 and 9.2 ppm. Log base 10 ratio that involves the CEST peaks at those two chemical shifts then has a linear correlation with pH. And here's some imaging that we accomplished with phantoms to show um, the that we can measure pH in phantoms. Unfortunately, the monomer agent and the polymer agent, based on salicylic acid, did not give a pH value that was independent of concentration. Our hypothesis was that by taking a ratio of two assessed peaks on the same agent, that would obviate the dependence on concentration. But that is not the case. As you can see, there is a change with the pH measurement made with the monomers and with the polymer agent at different concentrations at each of these pHs of the solution of the phantom that was used. And so in general, the CEST-based pH measurement is overestimated at low pH and underestimated at high pH for the monomer and the polymer. And unfortunately, this was a detriment to an in vivo study with an MDA MB231 tumor model where we injected iopanamidol, which is a agent often used for acidocyst MRI to measure tumor pH and is fairly well validated. And we also then injected our monomer and polymer into the same mouse and also into different mice. You see that the pH of these tumor models was always consistently low, but in the monomer and polymer, the values were much higher, leading us to the conclusion that the polymer overestimates extracellular pH in the tumor microenvironment when used with an acidocyst MRI method. With that, I'd just like to thank all my colleagues in our laboratory who helped me with this work, and I'd like to thank you for your time.